Now I'd like to welcome Dr. Kwak Young-hwan, clinical instructor at Soonchunhyang University Hospital. Good morning, doctor.
Good morning.
Hope you had a great weekend.
I did. Thank you.
Did you enjoy the Saturday weather? It was beautiful.
Yes, from the inside of the house, though.
From the inside. So very good at practicing social distancing. Well, unlike yourself, I think, a lot of people did take the occasion to go outside and enjoy the fresh, clean air and spring in full bloom. And we have seen the rate of people visiting local parks actually go up, even more so, I think, because of COVID-19. They're spending less time indoor places, indoor facilities, and thinking that these outdoor parks will be a little safer. So social distancing, it has been stressed as probably the only sure thing to slow infections at the time being, because no vaccines and no treatments are available. But people are visiting local parks, and I think they will continue to do so in probably greater numbers now with the easing of social distancing measures as well. So what are your views on this? Do you think it's good actually for people to go out a bit and at least let off some steam there, get some exercise, get some vitamin D, and socialize at least outdoors where it seems to be less dangerous? What do you think about this?
I mean, I understand what people are going through. They're so eager to go outside because they've been inside for so long. But I think people having more activity outdoors is better than still gathering indoors. Let's say it's still better than throwing rounds of soju and sharing a plate of meal in a confined space. But we still have to stay apart as much as we can, even when we're outside. And I'm saying this because there is a certain limitation to doing exercises within the house to stay healthy. There is a limit to what we can live, what we can't really run around in the house. So we can't just keep everyone inside forever. But I still want to emphasize that the thing to keep in mind on the issue is that we should be aware of social distancing measures at all times, no matter where we are, even we're outside or whether inside. And this means that we need to wear masks even when we are outside. And also, we need to keep hands to ourselves and keep sanitizing ourselves, whether when we are outside or inside. We need to be careful when taking drinks outside with us, like that of takeout coffees. And I've seen people having their masks on their chin and drinking coffee out of a straw while walking. Right. And that is clearly of no use. If you're not going to wear a mask properly, it's not really going to work for you. And that's just same as walking around without any protection from aerosols. We also need to keep our masks on when we're talking to another person, and we need to still keep it on even when the weather gets warm. So keeping physical distances is also definitely necessary. And we've heard a lot of people saying 2 meters is a mandatory distance that we need to keep. But let's keep in mind that there have been numerous studies that shown that the aerosols can spread up to 6 meters easily. So that in mind, we should not gather in a group of more than 3 people because more droplets mean basically more chances for the virus to transfer. People should avoid going to congested areas. And there are proofs now that the virus exists inside saliva and not just in phlegm. And this is a whole another story because this enables the virus to travel across the people just merely talking loudly, not only when they're coughing and sneezing. So the purpose of social distancing is to minimize risk of spreading virus among people. So if we keep distances as much as we can doing the activities and keep all the necessary measures, I think we can stay hopeful for people being outside.
Right. I think a lot of people will have seen those, I think, graphics in the recent news where you saw people, they were simulating when people would be like jogging together outside. And if someone coughs or sneezes, or maybe even just talks, that saliva or that the aerosols can travel back like 6 meters, as you said.
Right.
So it's almost safer to actually jog or walk side by side rather than behind one another.
That is correct. We've seen a lot of footages showing people who is running in front and just probably sneezing or just talking loud. Their aerosols can pass to the person behind.
Even outside.
Well,
with the wind and all the other factors.
I would actually say the wind and the whole air being outside can dilute it a little bit more than the graphics that actually showed us. Right. But we still have to be careful.
Yeah, that's why we recommend putting your masks on and keeping them on even when outside.
Absolutely.
Now, we have talked about this before, how the weather affects the virus and its ability to survive. There are a couple of studies, especially from the U.S., that have shown that the sunlight seems to be very good at destroying the virus. So as we look forward to the warmer weather and also not so much looking forward to it, but the humidity as well, I guess could we maybe expect the virus to actually spread a little slower, or maybe the even containment? Would that be possible with the hotter weather?
I am hopeful for that personally, but we have to take a very objective approach to this. There have been numerous studies from different countries showing warm temperature and humidity weakening the strength of the virus. But first of all, these were all done in lab settings and simulations of real life. But as some studies also mentioned, the ultraviolet rays from the sunlight dismantling the DNAs of the virus takes a certain time, however short it may be. And these are not stronger than the infectivity from physical contact. So I want to give an example. For example, in Singapore, they probably had many different factors working into this, but their warm weather, along with their other strong measures, helped to slow down the spread, and they had good mitigation until very recently. But once they started loosening up their measure, even with the warm temperature and humid weather, they were hit hard with cluster infections, and their graphs started to go up very quickly. Some people state that if people begin to stay more indoors from heat and humidity because they have their air conditioners on and etc., it may actually spike up the numbers because people can come easily into contacts with staying indoors.
Right. Speaking of Singapore, again, like a month ago, they were quoted as being one of the best countries in containing the virus. Now their numbers are upwards of 6,500. They eased the restrictions on school, but then they saw some cluster infections in kindergartens. And the greatest problem now are those migrant worker sort of dormitories, right? Where you have these people in close proximity. Social distancing really isn't possible. And that's why we've seen the huge surge in the numbers there.
That's very correct. And that's something that we should find as a model to follow from Korea as well.
Well, in a related sort of story, or it could be related because of that close confined quarters, we saw the 2 cases of COVID-19 at a training camp in Nonsan. Now, the barracks, of course, will be very confined. The risk of infection there might be higher as usual. Do you think that this should call for maybe canceling maybe military ceremonies or maybe even postponing the new recruits from joining the army as well?
So I would say we should cancel the ceremonies that invite outside members because there are concerns when people are met with people from the outside, there is greater chance for the virus to actually travel inside. But postponing people from actually joining the army training, I would say, is not quite necessary. This is on the basis that they keep all the measures well, and I believe that they are doing well with that. The 2 trainees who are confirmed were stated to have been staying at a preventative isolation facility. And what it is that the hospitals have these rooms too. So what this is that people spend a day or two in the pre-admission rooms in isolation while they're being tested for COVID-19. And once they are confirmed negative, they then move to regular rooms to receive their treatments like surgeries and etc. But this enables the separation of physical spaces so they can prevent possible infection getting into places that have many people bound together. The 89 people that they came into direct contact with the 2 confirmed patients hopefully will stay negative, but turning positive for them later on is still a possibility. They probably were put under quarantine for 2 weeks because they came into contact directly. For people that must stay in groups in confined spaces like in military and nursing homes, the best measure is to simply minimize contact with the outside.
This 2 weeks sort of, I guess, incubation period, or this is usually when we see the symptoms appear. Do we still abide by that? I mean, because we're learning new things about the coronavirus all the time, but this 2-week guideline still seems to be valid.
Yes, it is. It is because we have to take into consideration the whole majority of people showing up their symptoms is usually within the 2 period of time. Yes.
All right. Of course, with the lower number of new infections in Korea, I think a lot of our attention has been turning to the cases of relapse or reactivation or reinfections. I think reinfection, we're not using that word so much, but they were released. Many people were released from hospital, or maybe they never showed any symptoms, but they were declared to be free of the virus, usually after multiple testing, but then they relapsed or they tested positive. 179 of these reinfections or relapse cases. Again, we haven't heard of any cases of them infecting others after this relapse. So how concerned are you about this, and what should we be looking out for?
This is quite a concerning finding, of course, but we should not be too scared about it because it's currently being studied. Let's put it that way. This issue is a little bit tricky. We cannot state those people were actually reinfected by the virus. Currently, they are weighing more on the possibility that the virus was hiding under the radar, but had been there all along for the people who tested positive again. But there is also no proof that the people were not reinfected either. So I'm trying to say here that it's the matter that we should study further into.
All possibilities are kind of open right now.
Yes, for now. But a study recently found that COVID-19 virus is able to destroy immune cells in people going through more severe cases. This means that people with immune system weakened after the virus will give less fighting to a new virus attempting to come in again and can be prone to reinfection. But we're also seeing a lot of people at the end of the treatment showing their test results indeterminate, meaning they're not clearly positive or clearly negative. But as you said, those people are usually told to remain admitted in hospital until 2 consecutive clearly negative results come out. But if a person's immune system fought the virus well enough and eliminated the virus to test negative at the end of the treatment, they would be released. But in fact, if very few numbers of the virus remain inside the body, it can certainly replicate itself a number of times after the people are released from the facility and come back out to seem like they were reinfected.
Just as a follow-up question, doctor, if you were supposedly cured, but your immune system was compromised, you have a weaker immune system, can you be reinfected with the same virus?
Usually not the case.
Right.
But because we have very little knowledge of COVID-19 still, I would say we should give it a possibility. We quite often see with other diseases like that of influenza, those people are very prone to having secondary infections from other bacterial sources.
Okay.
So with other viral diseases, usually doctors give them antibiotics at the end of their treatment, not for the virus, but to prevent secondary infections from the bacteria.
So even those people who have been cured and released from the hospital, those 2 weeks of quarantine are necessary not for only others, but for their own health as well, because they could be more susceptible to other bacteria and viruses.
Absolutely.
All right. As we learn more about the COVID-19, we're also getting a lot of data, of course, from overseas. There were several factors that people were thought to be more vulnerable. Older age, chronic disease, underlying disease. Kind of one thing that was always surprising for me was people who had actually asthma didn't seem to be more severely affected by this, even though it's pneumonia-like symptoms. But obesity has turned out to be one of those factors. Why so? And also even race, especially in the U.S., we're seeing that as a kind of a deciding factor.
I actually want to point out in the factors that they've found smoking to be a very greater risk for the disability.
Rather than asthma.
Right. I just wanted to make that point because I'm in a study for cessation of smoking currently.
Okay.
But also, talking about the race and the obesity issue, there are 2 factors regarding obesity here. So obese people have more weight bearing on their lungs, and this gives them harder time to exchange oxygen in their lungs when they have pneumonia from the virus. The decrease in oxygen saturation level for people having pneumonia can cause serious consequences. Another factor is that adipose tissue, fat tissue, is known to contain a lot of ACE, and we've talked about this before.
Right.
This is the enzyme that are targeted by the COVID-19 virus as an attaching site to get into the body. So obese people are known to be at a greater risk for being infected and also to show more severity for the infection. But also, now we have to talk about race here. People's race can also count into many different factors. First is their socioeconomic status. People with less accessibility to medical care are likely to have severe infections because they're more likely to have underlying sicknesses that were not taken care of. But genetics also matter. Even though we have no scientific proof that connecting to the COVID-19 just yet, different races have shown weaknesses to different diseases in the history. For example, African American are more prone to having sickle cell anemia purely because of running genetics in their race.
Very interesting. And of course, we want to mention once again that smokers do seem to be more susceptible to the virus and also getting sicker from the virus as well. Let's talk about herd immunity. It might be a little too early to say so, but at this point, of course, we still don't know when a vaccine or treatment will be coming out. So herd immunity has been thrown about a bit. There have been some people in the U.S., I understand, even mentioning that maybe we should open the schools on purpose and maybe kind of promote herd immunity, at least among the children who seem to be healthier, who don't seem to develop very serious symptoms of the disease as well. So what are your views about herd immunity?
Right. So let me start by talking about the herd immunity itself first. Herd immunity is a phenomenon stating that if a certain percentage of a community become immune against the virus, usually through vaccination, they may function as buffers between those not infected and infective and block the spread of the virus among the whole population. And I think they're calculating the percentage to be about 60% of the COVID-19. That is how smallpox diminished in the history because eventually enough people became immune to the virus. We need to give it at least 2 to 3 weeks of seeing minimal increase like we are seeing now in case numbers before we take any steps of loosening up because the virus can take up to almost a full month before springing up in somebody. And I think exposing children to the virus is currently a dangerous idea just because we do not have too much knowledge of the COVID-19 yet. We don't know how it works basically. So we're just not sure if this is true, but children are likely to be symptomless to the virus rather than being completely protected from the infection, meaning even if they're not sick, they can still spread the virus to other people. And if, in fact, we have also witnessed a number of children actually getting sick from the virus, even in Korea.
And of course, the caregivers tend to be a little older here as well, so they might be more susceptible to these asymptomatic children as well. So
that's right.
In your opinion, a little too early for herd immunity in schools or whatnot.
Yes.
All right. I want to thank you very much, Dr. Kwak Young-hwan, once again for joining us and answering all of our questions.
Thank you.
Thank you. That was Dr. Kwak Young-hwan of Soonchunhyang University Hospital.